I will be talking about the intriguing topic of medical practice in the 19th century. This subject matter encompasses a vast array of essential elements, such as the survival rate of surgical procedures, the revolutionary use of anesthesia, the conditions of operating theaters, the profound influence of germ theory on medical practices, and the unique challenges encountered during times of war. The evolution of surgical techniques is a topic that never ceases to amaze. It has been a journey marked by countless hours of research, experimentation, and innovation, as well as a fair share of trial and error. Thanks to these efforts, we have seen the development of surgical procedures that are both safe and effective. Looking back at the history of surgery, it is clear that anesthesia and antiseptics were not always commonplace. In the past, surgical procedures were highly risky, and the chances of infection were extremely high. However, with the introduction and refining of anesthesia, the odds of surviving surgery have significantly increased. It is interesting to note that it was only in the 1900s that the probability of surviving surgery surpassed that of dying during or as a result of it. Modern surgical techniques such as laparoscopy have also played a significant role in improving surgical outcomes. With laparoscopy, recovery times have been reduced, hospital stays have been shortened, and complications minimized. These advancements have led to a significant improvement in the overall quality of life of patients undergoing surgery. It's worth noting that many of the surgical procedures that we use today have their roots in the 19th century. The development of antiseptics, anesthesia, and the use of sterile techniques were all significant milestones that shaped the future of surgery. It's truly inspiring to see how far we have come and how much we have accomplished in the field of surgery. During the 1860s, if you were to undergo a surgical procedure with a skilled surgeon in a modern European hospital, your chances of surviving the operation would be approximately 80%. However, despite the success of the surgery, the likelihood of leaving the hospital alive was 50-50. This suggests that a significant number of patients did not survive their hospital stay, even after a successful surgical procedure. Within the hospital wards, infections and diseases ran rampant, causing chaos for both patients and medical professionals. Despite the diligent efforts of surgeons to examine wounds and address tissue, an alarming number of fatalities continue to occur due to a medical phenomenon now recognized as sepsis or blood poisoning. Originally attributed to the unpleasant odor in the atmosphere, hospitalism was a mystifying and devastating disease that left the medical community perplexed and searching for answers. The medical field was not held to the same rigorous standards of hygiene and safety that we expect today. Surgeons would often wear their regular clothing while performing operations, which could potentially introduce harmful bacteria into the surgical environment. In addition, there was not a strong emphasis on regularly washing bed linens, which could lead to the spread of infections between patients. Perhaps even more alarming, surgeons would often carry their surgical instruments in their pockets, which is now recognized as a major safety hazard. This practice could lead to accidental injury to the surgeon or contamination of the instrument, which could in turn cause harm to the patient. In an effort to conserve hospital resources, some surgeons would reuse bandages and dressings between patients. While this may have been done with the best of intentions, it is now understood to be an unacceptable risk to patient health. The medical field has undoubtedly made great strides in recent times when it comes to placing high value on hygiene and safety. Nevertheless, it is crucial to never forget the lessons learned from our past experiences and to keep aiming for even more elevated standards of care. On the historical date of October 16, 1846, a revolutionary development in the field of surgery emerged. It was during this time that William T. G. Morton introduced the world to ether anesthesia, a safe and dependable method for conducting surgical procedures. This groundbreaking medical practice permanently transformed the landscape of surgery, forever changing the way that medical professionals approach surgical interventions. In the early days of surgery, patients had to endure invasive procedures without the benefit of anesthesia. Surgeons were solely reliant on their speed and dexterity to complete surgeries as quickly and efficiently as possible. Patients had limited options for pain management, which included the use of opium, liquor, or a blow to the head with a mallet to render them unconscious. Clearly, these methods were far from ideal and resulted in excruciating pain that patients had to endure. However, in the 1840s, medical professionals began experimenting with various agents that could help alleviate the pain of surgery. Nitrous oxide and chloroform were two such agents that proved to be highly effective in reducing the pain and discomfort associated with surgical procedures. These early advancements in anesthesia ultimately led to the development of modern sedation methods, which have dramatically improved patient outcomes and safety. Today, there are a wide range of anesthesia options available to patients, each tailored to suit the specific needs of surgery and the patient's medical history. Local anesthesia and numbing are commonly used to minimize pain and discomfort during procedures, while general anesthesia is often used for more complex surgeries that require the patient to be unconscious. Anesthesiologists carefully monitor patients throughout the procedure to ensure they remain safe and comfortable. When we consider the lack of life-saving benefits that were afforded by the use of opium and alcohol in the past, it becomes abundantly clear just how far we have come in the terms of medical advancements. Thanks to modern sedation methods, patients can now undergo surgeries with significantly less pain and risk than ever before, making surgery a much safer and more manageable experience for all. Throughout history, surgery has been a risky and intimidating medical procedure. In the past, many patients would die from infection or other complications after surgery. It wasn't until the 1800s that doctors and medical students began to gather in specialized rooms called operating theaters to observe surgeries being performed and learn from the process. These surgeries could range from minimally invasive procedures such as keyhole surgery to more complex operations that could last for several hours. Today, most hospitals have dedicated operating theaters, while larger hospitals have an entire operating suite that contains several theaters, changing rooms, scrub areas for staff, and preparation and recovery rooms for patients. The modern surgical team includes the surgeon, the scrub nurse, the anesthesiologist, and other nurses and surgical assistants, depending on the type of operation being performed. Each member has a specific role to play in ensuring the success of the surgery. However, during medieval Europe, surgery was a rare occurrence performed by doctors due to religious laws that prohibited them from shedding blood. Surgeons who worked outside the medical establishment would often perform surgeries in the patient's home. Wealthier patients would seek out a master surgeon whose status was closer to that of a physician. In those days, surgery was a far more dangerous and less regulated practice. Today, surgeons undergo years of general medical training before specializing in surgery. They must also pass rigorous certification exams to ensure they have the necessary skills and knowledge to perform surgeries safely. This is a far cry from the medieval times when surgery was fraught with danger and lacked the regulation and oversight that we have today. During the 19th century, surgical environments were far from the ideal conditions we have today. Patients undergoing surgery were subjected to unsanitary, overcrowded, and noisy operating rooms, which made it difficult for them to heal properly. To add to the unsanitary conditions, not all individuals present in the operating room were medical professionals. In fact, there were instances where people would come just to watch the procedure for entertainment. Despite the discovery of anesthesia in 1846, the risk of infection remained high due to the lack of sterilization. Patients were placed on a table while doctors, nurses, and curious onlookers crowded around them during the procedure. Unfortunately, doctors were not always diligent in cleaning their hands or equipment, which led to a high rate of complications and even death for patients undergoing surgery. It's a good thing that we've come a long way since then in terms of hygiene and safety protocols. Nowadays, we have far better surgical environments with highly trained medical professionals who prioritize patient safety and follow strict hygiene protocols to ensure the best possible outcome for patients undergoing surgery. During the days of operating theaters, the practice of maintaining a sterile environment in operating rooms was virtually non-existent. Surgeons did not pay much attention to washing their hands or instruments, and the operating tables were seldom cleaned. This lack of hygiene resulted in patients who underwent surgery developing post-operative infections, which, in some cases, proved to be fatal. To make matters worse, the operating rooms were often filled with spectators who brought in dirt and grime from outside, making the environment even more unsterile. As a result, sometimes the surgeons had to clear the floor before starting the procedure due to the huge crowds. However, with the advancement in medical technology, operating rooms have become much cleaner and safer. Nowadays, surgeons wear sterile gowns, gloves, and masks to maintain a sterile environment, making it difficult for germs to enter the patient's body. In the past, surgeons wore their regular clothes and aprons that were never washed and covered in blood. This lack of hygiene could lead to sepsis, a severe medical condition that occurs when the body's response to an infection damages its tissues and organs. Sepsis can be caused by bacterial, viral, or fungal infections that enter the body through unsterile procedures. But today, with the use of proper sterilization techniques and equipment, the chances of sepsis are greatly reduced, making surgeries safer and more successful. Historically, barbers held a multi-faced role that extended beyond haircutting and grooming. The more affluent barbers established their businesses and shops where they provided a diverse range of services, including hairdressing, shaving, and even surgical procedures. These establishments were known to feature a red and white barber's pole, which served as a symbolic representation of their two primary services. Even today, some traditional barbershops continue to display this iconic symbol as a nod to their rich history and multifaceted legacy. The germ theory has had a significant impact on modern medicine. It revolutionized the way we understand and treat diseases caused by microorganisms. The contributions of Pasteur and Lister and Robert Koch were pivotal in the development of the germ theory. Pasteur's discovery that the airborne microorganisms caused fermentation and putrefaction was a breakthrough in the field. Lister's application of carbolic acid to prevent putrefaction and compound fractures of bones was a major advancement in surgical practice. Koch's identification of microorganisms responsible for tuberculosis and cholera solidified the germ theory. Despite these breakthroughs, the implications of the germ theory were not immediately apparent. It took time for medical professionals to fully understand and implement the germ theory in their practices. Even well into the late 1870s, blood-stained frock coats were still considered appropriate attire for the operating room, and surgeons continued to perform operations without masks or head coverings as late as the 1890s. Today, the germ theory is widely accepted, and microorganisms are known to play a key role in the development of many diseases. Thanks to advancements in medicine, we now have a better understanding of how to prevent and treat these diseases. The germ theory has paved the way for modern medicine to develop vaccines, antibiotics, and other life-saving treatments. It has truly been a game changer in the field of medicine. During the 19th century, several scientists made groundbreaking discoveries in the field of medicine. In 1857, Pasteur found that germs were responsible for the souring of sugar beet during the fermentation of industrial alcohol. He also proved the existence of germs in the air and demonstrated that sterilized water in a closed flask remained sterile, while sterilized water in an open flask bred germs. 4 years later, Pasteur published his germ theory, which argued that microbes in the air cause decay and suggested that specific germs cause diseases. In 1867, he further supported his theory by showing that germs caused a disease in silkworms. Building on Pasteur's work, Koch identified the specific microbes responsible for anthrax, tuberculosis, and cholera. He employed innovative methods such as agar jelly to breed bacteria, dyes to stain bacteria for better visibility under the microscope, and photography to record his findings. Pasteur and his team continued to compete in finding and combating new microbes, discovering a weakened anthrax vaccine for sheep and eventually a vaccine for rabies. Other discoveries during this time included the diphtheria germ, the effect of its toxin, and synthetic antibodies that could attack specific microbes. The discovery of germ theory marked a significant shift in the understanding of the causes and prevention of diseases. Prior to this discovery, people believed that diseases were caused by factors such as imbalances of bodily fluids, bad air, or divine punishment. These beliefs often led to the ineffective, or even harmful treatments such as bloodletting, purging, or prayer. Germ theory, on the other hand, showed that diseases were caused by specific microorganisms that could be identified, isolated, and eliminated. This discovery paved the way for the development of vaccines, antibiotics, antiseptics, and sterilization techniques that have saved countless lives and reduced the spread of infections. Germ theory also had a profound impact on the fields of public health, hygiene, and sanitation, leading to significant improvements in living conditions and overall health. As one of the most significant scientific discoveries in history, germ theory completely transformed medicine and society as a whole. The topic of medical training has been a subject of debate among professionals for quite some time. One argument that has been put forward is that war provides the most effective opportunity for learning. The reasoning behind this assertion is that military surgeons, who are often young and inexperienced, are presented with a seemingly never-ending supply of cases on the battlefield. These physicians are tasked with treating a wide range of illnesses, including camp fevers and dysentery, which provides them with valuable lessons that they can later apply to civilian life. While some medical conditions are unique to wartime, many of the techniques, organization, and personal reforms implemented in military medicine during the 19th century were a direct result of experiences gained in the numerous wars fought in Europe and America. As such, it is clear that war has played a significant role in shaping medical training and practice, with military medicine serving a valuable source of knowledge and experience for physicians in both military and civilian settings. Johannes Friedrich, a distinguished military surgeon hailing from Germany, has made significant contributions to the medical field. Among his notable achievements is the invention of the first field dressing in 1869, which revolutionized the provision of medical aid in the battlefield. Dr. Esmarch also recognized the importance of equipping soldiers with first aid kits and training them to use it, a practice that is now widely adopted in the military. In 1873, he introduced the world to rubber bandage that is now famously known as the Esmarch bandage. This ingenious invention has since proven to be a lifesaver in many surgical procedures, especially amputations. By rendering a limb bloodless before amputation, the bandage effectively minimizes blood loss during the operation, resulting in better outcomes for patients. Dr. Esmarch's remarkable contributions to the medicine did not go unnoticed. He was appointed as the Surgeon General of the Prussian forces during the Franco-Prussian War in 1870, where he continued to demonstrate his medical expertise and leadership skills. Today, his innovations have become standard practice in both military and civilian medicine, a testament to the significant impact that military medicine has had on shaping medical training and practice. Amidst the Crimean War, a conflict ignited by the declaration of war by England and France against Russia in 1854, an extraordinary figure emerged: Florence Nightingale. Her exemplary nursing skills proved to be a beacon of hope for the wounded soldiers on the battlefield, and her dedication and unwavering commitment to her duties helped to save countless lives. Her pioneering efforts not only revolutionized the field of nursing, but also laid the foundation for modern nursing practices that continue to make a profound impact on our healthcare system today. Upon Nightingale's arrival in Crimea, with a group of 38 nurses and vital supplies for the patients in hospital, a significant number of men had already succumbed to disease rather than battlefield injuries. Despite the initial reluctance of military authorities towards the dedicated and diligent women, Nightingale ultimately demonstrated the immense value of good nursing. Her tireless efforts proved instrumental in improving the healthcare system and saving countless lives, serving as a truly inspiring example of the power of human compassion and determination. It is truly remarkable how Florence Nightingale was able to revolutionize the field of hospital administration and elevate the standards of healthcare by implementing round-the-clock nursing care and essential facilities such as kitchens and laundry services. Through her own personal resources and dedicated public appeal, she was able to make a significant impact on the healthcare system, showcasing the immense power of human compassion and unwavering determination. Thanks to her tireless efforts, the mortality rate decreased significantly, and the critical importance of quality nursing services was finally recognized and appreciated. The American Civil War was a time of great strife and hardship, and one of the most significant challenges faced by soldiers on both sides was the lack of adequate medical care. Surgeons and drugs were often short in supply, and the concept of antisepsis was virtually unknown. Even though anesthesia had been invented in the United States in the 1840s, many surgeons still had to perform amputations without it. It's hard to imagine the pain and suffering that these soldiers had to endure, but it's a testament to their strength and resilience that so many of them were able to persevere in the face of such adversity. One intriguing aspect to consider is that the Crimean War actually had some beneficial outcomes in regards to hygiene and sanitation practices. Specifically, it underscored the crucial nature of ensuring that soldiers are provided with sufficient rations and nursing care in order to combat the spread of diseases and infections. Despite some positive outcomes in terms of hygiene and sanitation practices, the Crimean War still faced significant challenges when it came to basic field hygiene, sanitation, and post-surgical care. This was especially true given that the war was fought before the acceptance of germ theory of disease, which made it difficult for medical professionals to fully understand and effectively combat the spread of infections. Nonetheless, valuable lessons were learned during this time that have since been used to improve hygiene and sanitation practices in both military and civilian settings. Diseases like dysentery, tetanus, and typhoid posed a greater threat to soldiers' lives than battlefield injuries themselves. This unfortunate reality serves as a reminder of the utmost importance of practicing proper hygiene and sanitation measures to prevent the spread of infections. It is imperative to ensure that all necessary precautions are taken to safeguard against the transmission of deadly diseases, as they can have far-reaching and devastating consequences for individuals and entire communities alike. By prioritizing cleanliness and sanitation, we can effectively mitigate the risk of outbreaks and safeguard those around us. The progression of medicine since the late 1800s is a topic that never fails to impress. During that time, physicians were confronted with an array of hurdles, such as limited resources and knowledge, which made their duties all the more challenging. Nevertheless, despite these limitations, they still managed to make significant progress in the field. Fast forward to the present day, and the advancements made in medicine are nothing short of remarkable. Thanks to the tireless efforts of medical professionals, we now possess a much more comprehensive understanding of the human body and have created sophisticated treatments and therapies that have enabled us to lead longer, healthier lives. We owe an immense debt of gratitude to those devoted individuals for their steadfast dedication to the field of medicine.